Thanks for joining. Today we're going to look at the side bend. And the side bend is one of the most popular somatic movements to address the trauma reflex, where we find ourselves in habitual or over-contracted state through the sides of the body. How might this happen? Think about hurting your foot, your knee, or your hip, and in order to avoid that pain, you shift your weight over to one side. That causes one side to be overly contracted, and all of a sudden your gait is affected. It's not so easy to walk or run. Maybe you're a mom who's put her baby on her hip, and we all know that that causes problems down the road. Maybe you're someone who's dealing with scoliosis, and you already know that one side is contracted while the other side is lengthened due to that curvature in the spine. Can you grab a blanket and a mat, and we're going to lay down and explore the side bend. Let's lay down on the floor, imagining that you are in a straight back chair. So having your torso in a straight line, have those thighs at 90 degrees, and also the feet not tucked back towards your buttocks, but directly under the knees. I'd like you to put your top hand just on your rib cage and take a few breaths and breathe into this top hand. See if you can begin to sense the ribs gently expanding, and then letting that slowly soften. Now, if you are unable to feel anything, I'd like you to just stay in this position for a little longer. Once you feel some movement there, can you allow the top hand just to come and lengthen alongside of your body? We talked about this accordion type of movement where we are going to feel the center here being drawn together as we allow the foot and the head to lift. Take a full breath into your side ribs and then begin to exhale, floating your top foot up as you draw that armpit down towards the hip. And you can let your head come up to assist. So notice this tightening here, and then slowly release that contraction. See if you can smooth that movement out. When you get back down to where you started, let everything relax. Breathing in, feel the ribs expand, and then exhaling, the armpit and the hip are drawn towards each other. I like to lift the head to help. Now just pause here. As you're contracting in this top waist, can you take a full breath into the bottom ribs against the floor? And then slowly allow yourself to release that contraction. Let everything go. So now we're going to look at a variation of this movement. Having the arm coming just alongside the head or the forehead. Now, if this isn't comfortable for you, your shoulder doesn't allow that, just stick with the first variation that we learned. Begin to breathe into these top ribs here. Feel that expand. And as you exhale and the foot draws up, sweep that arm up, reaching it down. And then slowly start to lengthen. As you feel the hip and the armpit creating more space. When you come down, let everything go. And that can just be letting that shoulder rest in front. Breathing into the top ribs. On your exhale, sweeping that arm up, letting the foot float up as you cinch the side of the waist here. Take a moment and breathe into the bottom ribs. And then slowly begin to lengthen your hip and armpit away from each other, creating a nice resting length. You might even feel the bottom ribs lifting a little bit away from the floor, and then allow everything to rest.